Introduction. My name is Marina, and I'm the Manager of Advocacy and Stakeholder Relations. I'm going to be leading the presentation today. However, I am new to the organization. I did start in January, so we're all very lucky and grateful to have Eric here because I'm sure he's going to be a real asset in answering questions and contributing to the discussion. So, first of all, what is a physician assistant? Physician assistants kind of have a tricky name because a lot of the time, because of the word assistant, people assume that they do something involving administration or and not necessarily to the level that they operate at. So in some ways, we almost we say physician extender sometimes because that almost more accurately represents the profession. So a physician assistant works with a physician, usually in an interdisciplinary health team, and they have delegated authority from the physician to help them in any activities that the physician is already doing. So this gives a lot more time to the physician to be able to see more people and really helps the healthcare sector. Our history is with the Canadian Armed Forces. That's where physician assistants started, but as the years go by, we're seeing more and more physician assistants in the civilian sector. So, and most importantly, I think is this last point where we do work very collaboratively with other health professionals. So the global landscape of physician assistants, there are physician assistants working all around the world in various different countries. There's about 800 currently practicing across Canada, and we're regulated in Manitoba and New Brunswick. Ontario has announced their regulation, but it's not currently in place. And Alberta actually just got regulated on April 1st of 2021. So that's very exciting that that's finally come into play in Alberta. And Ontario and Alberta becoming regulated is a huge part of a huge opportunity for British Columbia, because the more and more provinces that regulate physician assistants, the more likely we're going to get regulation across the board. The scope of practice. So these bullet points go over what PAs can do in a medical landscape. And I had heard that there was some questions around the differences between a nurse practitioner and a physician assistant. So I'm going to also briefly explain the differences there. First and foremost, they have different education. So nurses study the nursing model of medicine, whereas physician assistants are generalists. So they have a different education model. Nurse practitioners are often autonomous medical professionals. So as long as what they are doing is within the scope of their nursing practice, they can do it unilaterally without a physician sign-off. A PA works underneath the physician. So they work collaboratively and have that supervision component. So an example that I think is helpful is if a nurse is trained in the nursing model of care and knows how to do a particular procedure or recommendation or referral, they can just do it. The PA, as long as the physician allows the PA to do that, the physician assistant can do it. But maybe the physician assistant was working with one physician who did a specific type of procedure, and that physician assistant is trained and did it under that physician. If the PA left and worked with a different physician who didn't do the same procedure, even though the PA knows how to do it, they wouldn't be allowed to do it in that setting because it's not within their physician's scope of practice. So there's just a bit of a difference in that way. But we like to think that PAs and nurse practitioners can work very collaboratively together, and they both have unique and important roles that are complementary. So what is the problem? The problem is that physician assistants are not currently recognized in British Columbia. And that means they're not able to work in all the various settings that we would like physician assistants to be able to contribute to the health of British Columbians in. The solution is that we all work together to compel the government of British Columbia to regulate physician assistants. So this would require them in changing the Health Professions Act so that PAs can work in the different settings in a non-military capacity all across British Columbia. So we're in an interesting political context right now, as you all know as residents of BC. But because the governing NDP had the re-election during the pandemic, that provides a real opportunity to have a renewed focus on healthcare and healthcare delivery. The NDP's platform during the pandemic had a significant focus on healthcare delivery, including reducing wait times and making sure that all British Columbians, regardless of where they live, have access to medical professionals. So we're hoping that this provides as a new juncture and opportunity for the government to look at physician assistants and see them as more of a priority. And that's kind of where we're at with the government. We haven't necessarily heard that they don't want physician assistants, but what we hear is that it's just not a priority to regulate them. So we're hoping that because of this renewed focus on healthcare, it's going to increase in the priority list and hopefully get regulated sooner. So I just want to point out some research that we have. CAPA commissioned the Conference Board of Canada to do research on how PAs can positively impact the healthcare sector. As you see, some of these dates are getting a little bit old, 2016, 2017. So this year is actually very exciting because CAPA has allocated some of our budget to renew this research. So we're going to hopefully get it all updated with 2021 numbers. And we really find in our advocacy efforts that relying on data and research is very helpful in communicating the value to the government. So this is from the 2016 and 2017 numbers, but generally speaking, it all still applies. What we know is that having PAs can increase healthcare procedures and save physicians lots of time. So what this means is that we're reducing wait times and reducing healthcare costs. So this is a huge important point that we like to mention when we're advocating to the government. The government, regardless of who's in power, loves having a good bang for their buck. They want their dollar to go as far as possible. And we strongly believe that physician assistants help extend that dollar in the healthcare system so that more people are being served. So some of the advantages of PAs, a huge one is reducing the wait times for surgical procedures. And last week, the government of BC actually did their throne speech, and reducing wait time for surgical procedures was a huge component of that throne speech. So we're already seeing that alignment that we're hoping to use as a catalyst for our advocacy efforts. Improving healthcare outcomes is important, and as well as saving money as well. Something specific to this point for British Columbia is we really see how physician assistants can help, especially in rural areas, as well as on Indigenous lands. We know that there is a shortage of medical professionals in those rural or Indigenous areas, and PAs can be hugely beneficial in increasing the care of those areas. So partnership opportunities, one of the main things that we're looking for in BC is to have a chorus of voices joining us in our advocacy efforts. We've heard from the minister and the minister's staff that, CAPA advocating for PAs is one thing, but having Doctors BC and the BC Rural Health Network and physicians and nurses all saying that they want physician assistants, will be very helpful in our advocacy. So CAPA is extremely appreciative and grateful that your organization signed on to our recent letter to the minister, because that just shows, again, how PAs are not only needed, but wanted within the interdisciplinary health teams that they work with. So how you can further support this cause is, bringing up physician assistants in your conversations with the government, helping us educate the public on what physician assistants are and how they can benefit our communities, as well as helping to educate other allied health organizations. That's because physician assistants is still, a bit of a smaller profession and not everyone's familiar with it. People don't necessarily think about PAs as the solution to some of their problems. But like I said, the more we have the interdisciplinary health teams, the pharmacists, the doctors, the nurses, agreeing that PAs are a meaningful part of that interdisciplinary health team, the more successful we're going to be in our advocacy. So that was my very short and sweet presentation. I already see we have some hands. What I'm going to do is I'm going to stop the screen share, and then we can have a discussion and a little bit of a question and answer session as well. So let me just stop this.